In recent years, we have progressively strengthened our social safety nets. So let me provide an update on the Social Service Office, as requested by Mr. Faisal Manap. The SSOs are the cornerstone of our social assistance framework. In 2013, we started rolling out a network of SSOs to bring more accessible and coordinated social assistance to Singaporeans. By 2015, we had set up the full network of 24 physical offices across the island, and today 95% of SSO clients live or work within 2 kilometers of an SSO. For seniors who may require social assistance who are unable to travel to the office, our officers can conduct assessments at their homes. For immobile seniors who are already on our schemes, our officers also can directly credit the payment to agencies for their household bills if there's such a request or when officers assess that doing so will be helpful to the seniors. Ms. Sylvia Lim asked about some of these possible arrangements. We have those options available. Now, being forward deployed, SSOs develop a good sense of the local community's needs and enjoy better collaboration. Now, the SSOs are not the only players in the community. There are various stakeholders, VWOs, FSCs. So the partnership with them also enables the SSOs to get a better feel of the situation on the ground. So for instance, some of the products as a result of these partnerships. One of the SSOs have partnered North East CDC to pay for pest control services to assist rental flats residents deal with their bed bugs. In Bukit Merah, for example, our SSO initiated a Spooner Road powwow platform where all partners could coordinate their action plan for vulnerable families in the area. And this enabled clients to be better served in a holistic manner and avoided duplication of effort among the agencies. The various partner agencies continue to meet through this platform to share best practices and resolve complex cases. This is something that we want to encourage. We want to see it happening on a wider basis. Some of us as advisors, we're playing an active role trying to pull together the different stakeholders because it's important for the stakeholders to get together. Because when they talk, they build up relationships, they exchange information. That's when the real coordination and the real coordinated work happens on the ground. And it is much more effective that way. Mr. Faisal Manap also asked about the training received by SSO officers. 1 out of 6 officers have social work training. Officers also undergo training in areas pertinent to their work, such as engagement and interviewing skills, the assessment of needs, and financial literacy. I think it's also important to realize, as I mentioned earlier, the SSO doesn't exist on its own. It works very closely with the local family service center, where the social workers will then also follow up with the individual clients. There are also other players, such as the SAC and other stakeholders, where the partnerships is established. And so the social work community that exists on the ground comprises SSO and the key partners, who together try to address some of the needs that our residents face. Mr. Faisal Manap and Ms. Sylvia Lim asked about the ComCare scheme. We've extended the coverage to more families. Since 2014, we have increased the monthly household income cap for families seeking short to medium-term assistance from $1,700 to $1,900. And the cap on income per person was raised $550 to $650. So basically, we've extended the coverage in terms of those who may need ComCare assistance. We have also increased the quantum of long-term assistance. The most recent enhancement was last year, where financial support for one-person households on long-term assistance was increased from $450 to $500 a month. The rates were also increased for larger households. Households may also receive additional support to meet other needs such as medical consumables, adult diapers, one-off items like commodes, wheelchairs for the frail elderly. So this is some of the ad hoc needs that sometimes may arise and assistance can be provided. These are system-level improvements and scheme enhancements. At the individual level, SSO officers are empowered to exercise flexibility when providing social assistance to low-income families under the ComCare scheme. And that's something that is important. I think it's important for officers not to just follow a rule rigidly, but I think the space is afforded them to make some of these discretionary calls. Our officers will then calibrate both the amount, the duration of the short to medium-term assistance according to the different needs of families. For the one-off and ad hoc expenses, as mentioned by Mr. Faisal Manap, they also exercise flexibility and also tap on community resources to assist. I think many of us are familiar at the CDC level, initiatives initiated by us, working with the various stakeholders, the local merchants, the local VWOs. I think collectively we also help to provide some of these means to assist individuals on a need basis. We do want to help families get back on their feet, but some will progress faster than others. Ms. Sylvia Lim asked about how do you measure, and the honest truth is it is actually quite difficult. Is it about the numbers we're talking about? Well, by extending the coverage, we do have more numbers that we're assisting. Is it about how long they remain on help? But the reality is, it really depends. Because some are temporary because they lost their job, so they need something to tie them over. Others have more chronic family problems. They're not work capable. Some have health issues, so that's a bit more long drawn. So, but the key thing really is when they need help, are we able to provide them? And even though it may be short, medium term, it doesn't mean that after a few months you will cut it off. Actually, we have the capacity, and we do actually extend it when they continue to have those issues. Those, of course, on long term, very different. We will review them from time to time. For those on short, medium term assistance, we will adjust accordingly and will not cut off assistance prematurely. And if you do meet individuals who seem to have some of these challenges, do flag it up to us and let us know, because we will be quite happy to adjust, because we do make those accommodations. But as we all know, I think on the ground, the stories that we receive aren't always necessarily complete. So, but when in doubt, surface it, and we will be more than happy to assess it. So we do look at it from a needs-based approach, and we consider all sorts of the income. Ms. Silver Lim also asked about silver support. For those on short and medium-term assistance, obviously there will be some that are not receiving silver support. Some of those who receive silver support don't need short to medium-term assistance. But for those who are on short, medium-term assistance but are also eligible for silver support, now in these cases, we do compute the silver support quantum into the overall assistance, because otherwise the quantum basically increases quite significantly. And we are also quite mindful how to calibrate that amount. So the silver support is factored in for the short, medium-term assistance recipients. Ms. Denise Poor asked about families facing problems with debt and arrears. In fact, I was just having a discussion on this recently with an expert from overseas. Now, these families can approach the nearest SSO. The SSOs will work with relevant agencies such as Singapore Power, HDB, town councils to see if the debt can be restructured. And that's a very simple step, but I think it goes a very long way, and for many it makes a lot of difference. For example, what it does is allow the families to go on installment plans. Concurrently, our officers will assess the family situation, and they'll look at the ComCare to support their basic living expenses if necessary. And these efforts will resolve some of the pressing issues for many of them. However, ComCare cannot be used for the repayment of debts, to ensure that we also do not erode the values of personal responsibility. Can you imagine a scenario where basically if you're in debt and therefore public monies are then redirected to service your debt? Invariably, I think you can imagine the kind of behaviors that this can create. But we are also aware that for some families, and I do face them, and I think many of us in this house face them, where they, for whatever reason, the mistakes that they made, wrong decisions in life, they end up mired in quite serious debt. And it seems almost impossible to break out of that cycle. So in these instances, we would refer them to VWOs who are looking at these issues from a more specialized perspective, where they provide debt-related support and advice. And other organizations, the Institute of Financial Literacy, credit counseling, and basically exploring different ideas to see how best to also equip our social workers with the ability to integrate financial advice into the intervention plans for vulnerable families. So we welcome partners who are keen to explore such solutions. I'm aware of the Methodist Welfare Services who are providing some of these. I think it's early days yet. I think it's too early to conclude. And I think for those who are operating in that space, they also realize it's not quite so straightforward either. But we are mindful that this is, for a number of families, a serious issue, and we are looking at whether there are better ways to support them. The ideal way really is to prevent them from getting into that position in the first place. And that's where providing better financial planning advice and education early would be important. And it is also important for us to surface problems earlier so that we are able to step in, because a range of assistance schemes are available to help families, rather than let them trying to figure out solutions on their own, incurring more debt, and thereby creating a much more complex problem for themselves. So this is where the community needs to step in to support them, surface the problems so that we can step in and see what we could do early. But we do need to be forward-thinking. We need to try new methods because social safety nets also need to evolve with changing conditions. So I'm keen for us to be as proactive as we can, to go upstream to preempt issues. But at the same time, it is also important to reiterate that we have to strike a balance in terms of being resilient and preventing the sense of entitlement. Because by being so proactive, you can, even before you surface a problem, you come in and help somebody. I'm not sure that's always a very wise thing to do either. So it's a balance that we need to strike, but I'm very mindful that I would like to look at prevention as far as I can.